Congresswoman, I'd say that certainty going forward is what these small businesses need, and that relates to what we said: reimbursement, knowing what you're going to get paid down the road, and reducing the regulatory burden, which is huge. If you could help those two, you'd have a lot more physicians staying in practice.
Well, there's no doubt. I mean, the physician-patient relationship is the most critical thing that we can talk about, and our three colleagues here, I'm sure, would completely agree with that. But your only choice is to do more. And I would bet that each of these physicians here see a few more patients each year to be able to make their practice viable. Not so much as to just financial reward, but just to make it a viable business. They have employees, people to count on, and your own income is it. But the patient will be left on the sideline.
You know, the other thing that is concerning to me in regards to Medicare, as Mr. Smith said, you know, you're almost getting to a point where you're just barely breaking even as far as reimbursement is concerned. Mm-hmm. What happens in the next 10 years when they cut $500 billion out of Medicare because of ACA? Does anybody know? I mean, obviously reimbursement's going to take a hit. It has to take a hit. I don't see how else you're going to reach that number.
Example, if you put people on Medicaid, I think it's something like 40% of all physicians won't accept a Medicaid patient because the reimbursement is so low. And I believe my understanding of the ACA is that by 2019, Medicare rates will be around where Medicaid reimbursement rates are now. So I think that is a huge issue and a potentially devastating one for access to care for Medicare patients going forward.
If tort reform would have been part of the legislation, you would have seen a much greater acceptance of the physicians of this legislation and the changes that were coming. But we have seen in states that have applied tort reform that it's a significant cost savings.
If on a regular basis a physician actually read all the documents that you're supposed to sign every day, it would add hours to your day. There's no way. You have, you know, reams of documents that you go through every day and you sign your signature on, whether it's home health or, you know, hospice or Medicare, you know, documentation. It's huge, and there's just no way you can actually even read it all.